The degradation of community ties across America has created an unprecedented health crisis impacting millions of lives. Our next guest, Darin Buxbaum, is addressing this epidemic as co-founder and CEO of Wider Circle. Drawing from his personal experience and deep healthcare expertise, Darin is pioneering an innovative approach that connects health plan members with trusted neighbors to create lasting, supportive communities. Previously founding successful healthcare ventures and recognized among the top 40 innovators under 40, Darin brings unique insights to community-driven health improvement. Join us to discover how Wider Circle's peer support model is revolutionizing healthcare delivery, reducing costs, improving outcomes, and most importantly, giving people a renewed sense of purpose and belonging. Let's go.
Welcome to Passionate Pioneers with Mike Biselli, where we highlight and speak with the innovators, the game changers, and the pioneers who are deeply passionate and relentless in solving the problems our world is facing today. This is your opportunity to connect with and learn from these leaders and to support them on their mission. Perhaps they will soon be hearing your story as well. This is Passionate Pioneers with Mike Biselli. I look forward to having you on this journey with us.
Hi, Darin. Welcome to our podcast. I'm so happy you're here today.
Great to be here, Mike.
Well, given your passion and dedication to building communities to improve health and quality of life through trusted connections across our nation, I'm excited to have you on the podcast today. But before we dive in, a bit of housekeeping. While listening to any of our episodes, please take a moment to subscribe to the podcast so you will automatically receive episode updates in your podcast player. Simply search Passionate Pioneers with Mike Biselli in Apple Podcasts, Spotify, or wherever you listen to your podcasts. And lastly, please visit the bottom of the episode notes to connect with me on LinkedIn and X in order to further the conversations occurring on this podcast. All right, Darin, it's almost time for our community to learn how you and the Wider Circle team are connecting health plan members with familiar neighbors to inform, support, and motivate one another and empowering them to be more proactive about their health. But first, what's that one piece of advice that you would give to others who are passionate about reimagining the health of our world?
For anyone who wants to reimagine the health of our world, I would start by getting skeptical advisors who are experts in your space. The type of people who are not going to let you off the hook on your idea. They're going to look at it at every angle, and that you have to convince that this is going to be successful, that this is going to change the world. Then you know you really have something.
Now, the other question on that then, Darin, is when do you do that? Do you do it right out the gates or do you wait a bit? Because, some people, and no offense, I maybe was one of these in the prior life, but a lot of people have a solution and they're going to go and try to find the problem to solve for it versus the other way around. How important it is to have those types of advisors right out the gates, because as well as I do, you got to solve for pain points in the marketplace versus solving for what you think is what is needed in the marketplace.
Oh, I would get them as early as possible. Once you realize there's a particular space that you want to be in, I'd start looking at experts. Started a few companies now. I will say spending that time is more valuable than any money you can possibly spend in accelerating to a market solution.
Well, of course, we're going to discuss your background here on the other side of the commercial break, but let's also a little bit more in depth on that. When you start thinking about healthcare and the multi-sided aspect healthcare is, right? It is incredibly complex, right? And so we've seen many entrepreneurs that try to come in, whether they be from the outside. Heck, we've even seen large co try to attack and innovate and reimagine healthcare. It is complex as can be. So I got to imagine when you start thinking about those advisors and then those mentors or otherwise, having those experts in the room can only benefit, helping build these companies in a very, very complex industry.
Absolutely. I mean, healthcare is unfortunately filled with a lot of perverse incentives, a lot of middlemen, a lot of hidden interests, and having those experts really help uncover the speed bumps that going at it alone, you'd slam into a wall pretty hard.
Well, we're going to discuss those experts, those advisors that were there for you in the early days. You guys are now over 9 years old as a company. That in and of itself is an absolute feat. An incredible story. I cannot wait for us to hear about it. We're going to discuss how those advisors in those early days shaped to where you guys are today. We're going to unpack all of that and more after we get back from thanking our community champion sponsor. Healthcare faces a paradox that echoes through generations. While the current practices that help heal patients today are vital, it is crucial to evaluate them through an environmental lens. OSER's Responsible for Tomorrow initiative is a collection of interviews featuring influential thought leaders and industry experts like you who share their sustainability strategies, insights, and provide valuable perspectives from diverse industries to inspire innovation within the healthcare sector. OSER invites you to join this journey. Want to share your sustainability story? OSER is actively looking for partners to highlight the important and inspiring work being done around the globe. Check out OSER's Responsible for Tomorrow initiative and series at OSER.com. That's OSSUR.com. Or visit the episode notes and click on their link. Together, and with OSER helping lead the way, let's all be responsible for tomorrow. All right, we are back with Derek Buxbaum, co-founder and CEO of Wider Circle. Darin, thank you so much for really teeing us up on the front end. Have to surround the team with the right people to get to that point of being able to be successful in this industry. It is a complex one. We discussed before we recorded. I am a former college athlete and team member of a college football team, so I know exactly the power of surrounding yourself with the right players to make things come true, if you will. And so that's the same thing here with these types of companies that are trying to come into healthcare and really move the needle. It's a complex industry. And you guys are doing exactly that. Now over 9 years old, Wider Circle making incredible impact. And as some may say, perhaps maybe you're just getting going, because I can tell you this need in the marketplace is becoming more and more acute. We see it time and again, this kind of degradation of community. We're going to discuss how you're solving some of those big problems across our nation. But of course, we got to ask, how did this all come to be in the first place? How did this come into focus for you to become the co-founder and CEO? Then, of course, we'll discuss a little future state as well. Where do you see things heading? What should we be mindful of as a community tuning in? And where do you see things kind of heading in the direction, hopefully in the positive, and where, of course, Wider Circle will be in that future state. And then, of course, we can't let you out of here until we can figure out how we can be helping you as well. But Darin, let's take it back a bit. Let's kind of rewind that clock. How did this come into focus? You mentioned it on the front end. You founded a couple companies along the way. How did Wider Circle come into play? Where did you see that need, those aha moments to say, yep, this is it, I'm going all in? Give us a little bit of that backstory.
Sure. Like Wider Circle, everything really happens through the power of community. And in this case, a colleague and friend from business school days at Stanford came, Moshe Pinto, and said, Darin, we should really do something together. And I said, all right, well, let's do that. And we looked at an array of challenges out there, because I'm a huge believer, and I'm not doing this, I get to lecture at Stanford's Biodesign Innovation Institute. Always start with a problem. And we were looking at problems that are out there, but when you want to do something that's really going to change the world, you got to believe it in your heart also. And one of the ones that just kept coming back to us was loneliness. And we would do a lot of primary research, but we kind of had primary research in our lives as well. And for me, it was my grandmother who made the best chicken cutlets in the world. And unfortunately, after my grandfather's passing, her world shrank. And we did what loving families do, move her closer, fantastic facility, but she never reconnected. And her health spiraled precipitously. And I think we all, unfortunately, know of stories like this or of experiences like this in our lives. And it really just came into view. And I just really wish I knew then what I understand now, which is just how truly powerfully important to our health, to our happiness, to everything community is. I had that story with my co-founder. He had a family story as well. And we said, look, let's go figure out how to solve this. We're in Silicon Valley. You think AI is the answer to everything. And the more research that we did, this isn't shocking. People need other people. People really do need each other. And so the journey has really been one to prove that out, because in healthcare, I guess the real metric for healthcare is oftentimes claims. Claims are the source of truth. And so really taking this from a concept to truly a gold standard intervention has been that journey.
Well, Darin, thank you for teeing that up. And you're absolutely spot on. All of us in one form or fashion, whether it be friends or family or otherwise, we have all experienced what loneliness can do and how impactful it is to so many across this nation. But Darin, of course, there you were as a team solving this well before the pandemic, right? 2015, you guys are starting to form up the company. And then, of course, we saw loneliness laid absolute bare through the COVID-19. And of course, we're still living with it today and trying to figure it all out. But this topic of loneliness has been with us for quite some time. And you kind of talked about, hey, you're in Silicon Valley, AI, or I'd even like to say, hey, there you were in Silicon Valley. There they were in 2007 with this big invention called the iPhone. And this is going to change connectivity. And now all of a sudden, everybody's going to have these social media apps in their pockets. And here we are today on a completely different trajectory than maybe we all thought initially. But I share all of that, Darin, because you guys were at the table thinking about this many, many years ago before so many of us were talking about it because of being forced to with the pandemic. Frame it up a bit for our community, and we'll discuss after that and kind of the communities you serve, who are the stakeholders, et cetera, what you guys are working on today. But maybe frame it up a bit more, Darin. How pervasive is this problem of loneliness? What does this mean, whether it be the economic engine for our country? What does this mean in regards to the kind of the social fabric of our nation? How big of an issue is this?
So loneliness, tremendous challenge. I mean, worse for our health than smoking 15 cigarettes a day, and large enough of an issue where the Surgeon General proclaimed it an epidemic in this country. So the magnitude, unfortunately, knows no bounds. I would say an additional challenge that the loneliness has created is the sense of mistrust in society as well, and mistrust in, unfortunately, in communities and in institutions as well. All of this is actually tied together. And to really heal society and strengthen our social fabric, what we quickly realized is we couldn't just solve loneliness, as if that wasn't big enough. We really needed to rededicate communities to rebuild the trust. And by doing that, by rebuilding trust, by giving the sense of purpose, honestly, we solve loneliness. But we're actually finding that we solve not just issues in healthcare, and I'd love to get into this, but truly issues just in society.
Yeah, I couldn't agree more. There's so many domino effects from just starting there. I mean, and we'll discuss that a bit more, of course. Maybe let's go there a bit. Darin, go ahead and frame it up for us. Who is Wider Circle?
So Wider Circle, we are a technology-enabled services company that forms peer support groups in order to enhance health and enhance happiness. We do this on behalf of traditionally health plan sponsors like Medicare and Medicaid plans. And why they're doing it is once we actually create these peer groups of engagement and support, we're able to get members to do the behaviors and take care of each other, take care of themselves. They'll do preventative care, annual wellness visits, close quality gaps. And because they're having such a great time, they tend to have a wonderful member experience and help with satisfaction and retention and every other metric that the plans look to engage members on.
And Darin, let's go maybe a couple steps further into that. Discuss some of these groups. Are they being formed around, say, a book club or maybe a love for cycling? Or how are these groups kind of formed up? How do they become members of a group?
Yeah, so first, it's important to know that most of these groups are in real life, like people who actually see each other, can hug each other, which is, I mean, a very innovative idea today. And because of that, location is a really important aspect of this. But we are a very, very data-focused organization. And so we ingest a lot of healthcare claims to understand which members can really help each other. So today in healthcare, a lot of plans and providers focus on the sickest of the sick or the completely unengaged members. And what we fail to realize is you engage the unengaged through the engaged. It's your neighbor. It's your friend who's doing everything right that all of a sudden you're like, maybe you should do that. And you're like, yeah, maybe I should. Because back to trust, it's not like there's a significant loss of trust in health plans. And I won't get into recent news too much there. A person's just not going to trust a vendor because they call, but they do trust their neighbors. And it's really that peer-to-peer connection that enables people to take better care of themselves. So we purposely put individuals who may be going through challenge, and it's not just a single disease state, with individuals who are doing everything right. They've cracked the code. They're the positive deviants in society. And it's really through that joint effort that the community becomes stronger.
So, of course, we got to discuss outcomes because that's what a lot of this is tied to. What has the response been, whether it be from, let's think of some of those, the insurance companies, if you will, or providers, if they're in there as well. But of course, most importantly, from my perspective, the members themselves. What has the response been?
Yeah, so the response from members has been wonderful. we're very much an organization where kumbaya meets calculators. So this is a feel-good program. Members come back, and I'll just tell like one member story where I was recently at an event here in San Mateo County, and a member kind of pulled me aside and just wanted to thank me. I said, well, no, thank you for being a part of this. And she was like, no, you don't realize before this, I just wanted to throw myself in front of a car every day. And this has become my family. This has given me a reason to live. And so I'm so grateful that I get to participate and be a part of this at Wider Circle. So you don't need to measure to really know, but we're in healthcare. You need to measure. So on the calculator side, we've brought in top actuaries like Milliman, and we've done peer-reviewed published studies. We just co-authored a study with Humana. We've done studies in Medicaid, Medicare. And the bottom line, it's really amazing, is by being part of these peer support groups, members go to the hospital less. Like, we reduce inpatient utilization. We boost quality measures and preventative care. And we've now published studies that show we save $115 per member per month on the cost of care. So yeah, there's like actual real dollars at play here, as well as for plans. We've cut their attrition in half. We've even helped a plan credits us for getting them from 3.5 to 4.5 stars and earning massive quality bonus payments.
Unbelievable results. That's phenomenal. And to hear, yes, those are big results kind of, when you think about on a macro level, but to hear that story, as you mentioned, from one of those members in San Mateo County, I mean, that just brings it all into focus. Incredibly, incredibly powerful. Of course, Darin, obviously, this is an area that is continued focus for many of us as we continue to try to reimagine and reinvent health and care across our nation. So this notion of community is, at least from my perspective, is more top of mind than ever because of everything, the downstream effects, the domino effects of that. If we're not focusing on it, what is it going to actually really do for us long term and on the ill side effects of it all? So how are you viewing future state? What are you seeing on the horizon, whether it be for the industry that we should be mindful of? And then, of course, where is Wider Circle going to continue to help make an impact for our country?
Yeah, look, it has not been an easy for the industry, and Medicare and Medicaid, kind of our main lines of business. Reimbursement hasn't been as high for these plans as in the past. There have been a lot of new regulations. And what I love to tell my team is, with every challenge is an opportunity. The way I look at it is, plans can't just try and game the system anymore and try and just move a few pieces around. Like, more and more, it's going to have to deliver real quality and real engagement with members, and not just with some, with all. So kind of getting back to the beginning of the discussion, which is plans, through no fault of their own, need to focus on typically the unengaged or more costly members. But a lot of these measures now are measuring the entire population. And so that's a tough thing. Like, how do you take scarce resources, like government isn't really opening up the wallet any further, and how do you support an entire population? And what I think a really critical answer is, we need to tap into that power of community. There are so many people, they can't help themselves, but help others. In our model, we call these the ambassadors. They're like super members. And what's really amazing, like, I've met ambassadors, they've read the benefits handbook cover to cover. And then I'll talk to execs, they'll be like, at plans, I haven't even read that cover to cover. And these folks want to actively help each other. They know the best dentists in town because they're going to them. They know doctors that they're happy with. And so they can actually help navigate in a very, very trusted way their peers and reach out into the community in a way that it would just be unaffordable for plans to do themselves. So I think the population health and population-based quality metrics are just becoming a bigger item there. And then plans needing to really focus on rural communities more as well. Talk about resources being spread thin. I mean, that's spread thin over long distances. Like, how do you do that? I remember we had an event in a rural area where an ambassador was there, and she noticed one of the regulars didn't attend. And so she got really worried, called them up. They weren't picking up their phone. She actually drove back out, it was 40 plus minutes, maybe it was over an hour, knocked on the person's door to check on them. And he apologized. He was just sick. That day, he was fine though. But can you imagine how appreciative we all want someone to like notice when we're not there, we're not feeling well, and be there for support. But we live in communities. We're here to support each other. And I think that's a very, very, very powerful thing for plans to leverage more.
Well, and let's also talk about a little bit, and wanted to ask this earlier, and I'll ask it now, because to me, it's also incredibly important. When we think about community, this isn't just about one generation, right? We may automatically assume like, oh, this is for the baby boomers. This is for the folks that are retired that should be using this. I mean, we're seeing mental health crises across the generational spectrum, right? And so where do you see things, whether again, be a current state or even future state, where do you see an organization like Wider Circle maybe helping out the millennials, maybe helping out the Gen Xers, et cetera, even the younger folks in our communities? Where do you see those needs as well?
Mike, you hit it on the head. And we serve members from 1 to 101. We started with in the older adult population and talking about these important advisors. By the way, I love CFOs. Maybe I'm the only person that really loved that. They're great. They're very skeptical. They've been sold a bill of goods on everything. And so they're wonderful in really getting to the core. One of them said, you know what? This Medicaid needs this. Medicaid, there is not enough trust in institutions in Medicaid. So how do we get people to get vaccinated? How do we get people to do preventative care? And they said, I think this is the answer. So we've created maternity support groups. We've created groups, as you've said, across the generations, intergenerational as well. I mean, this throws me back a little bit, but when we first started the organization, I was one of these community engagement leads. I was out there with the members. I remember having members in the group. Some of them were in their 30s. Some of them were in their 60s and 70s. And I'll tell you, the older adults in that group, they take such great care of that 30-year-old. They're like, I remember when I was your age and how challenging it was. Gave them lots of advice. Sometimes they even bought them lunch because they were like, you haven't eaten today, have you? They're like, I haven't. And so they really were trying to help each other get a leg and be more resilient and just be more successful.
I love it. I love hearing those community members taking care of one another. And speaking of taking care of one another, we have a heck of a community rallied around this podcast that absolutely loves to help out our guests. So what's one problem, need, or question that you and the team have that our community can be helping you with?
I'd say our biggest need is to find these amazing ambassadors in every community. So if folks have a loved one, a friend that is just one of those amazing people who can't help but help other people, let us honor them. Contact us and let us make them the superstar that they already are in their community. We can put incredible resources behind them to supercharge and make a real difference in their very neighborhoods.
Well, Darin, how do they plug in? How do they get a hold of you and the team? Where do they find you online? Social media handles, websites, contact points online. How do they get a hold of you?
Absolutely. So probably best way is through our website, widercircle.com. We also love LinkedIn. And so we're at Wider Circle at LinkedIn. And frankly, they can email me directly. Easy to get a hold of, just Darin at widercircle.com.
Easy enough. And for our community tuning in, just scroll on down into your episode notes, your favorite podcast player, to find those contact points for Darin and the team. Of course, you could also head over to our free global online community at passionatepioneers.com. There will be a post for Darin's episode with all of those contact points online as well. Again, over at passionatepioneers.com. Darin, we're almost done. This is one heck of a conversation, one I've been waiting for some time. I'm so thrilled to have you on the show today. But before we let you go, we do have one more piece for you. It's a fill in the blank. I'm a passionate pioneer because
everyone deserves the support and power of belonging to a community.
Absolutely. Absolutely love it. Darin, thank you so much for being with us today to share the story of Wider Circle and the incredible impact you're having across our nation. We are rooting you on. We cannot wait to continue to follow your story, and we will absolutely be rooting you on along the way. But for now, Darin, thank you so much for being with us today.
Thank you, Mike. It's been an honor.
Thank you for joining us today on Passionate Pioneers with Mike Biselli. We'd love to hear your feedback about the podcast so we can continue to improve this community and to further support the pioneers being featured. Lastly, please take a moment to subscribe to the podcast and invite your friends and colleagues to join us. This is Passionate Pioneers with Mike Biselli. I look forward to having you back with us during our next episode.